This next lecture is a challenging one, but everyone faces it, and that's one of the things that we attempt to do in these lectures is to select topics that relate to problems that the population, each individual face, and that has to do with healthcare. And even the federal legislature has called in representatives from major drug companies to protest the pricing of pharmaceuticals, which I use as an example. The fact that the life-saving drug Viagra came on the market, and there's supposed to be a certain amount of humor in that, at over $80 a pill. And currently it's out of patent, and through one of the major drug chains, you can get a month's supply for less than $1 a tablet, which is a good example of the inflated, exploitive price of medical drugs and why the United States has the highest healthcare costs of any nation in the United Nations. And the last figure I have is $10,300 per citizen per year, and rapidly increasing, and I'm sure it's higher now. And periodically, the World Health Organization does a survey of all nations in the United Nations. And the United States didn't come in number one in this survey of quality of life and health status like it did number one in cost. It came in number 35. And there have been efforts to alter this terrible situation. And I address it in one chapter in the book I'm writing, of a major effort that was done at the federal level. And when they call in representatives of the drug industry, they point out that we're saving the lives of mothers, fathers, and innocent children. How do you put a monetary price on the cost of a life of a mother, father, of a child? And that they offer that they have to evaluate at least 200 substances and do all the work on them to try to get it through the FDA to get just one drug through, and that it's very expensive and they must recapture all those expenses. But they ignore the fact that all major employment groups in various states that have foundations, that they all want to have a large block of pharmaceutical stock, because when the market goes down, the price of the pharmaceutical stock stays up better than any other. And when the market goes up, it goes up. And they also provide dividends for each share you have, because their profitability is so much greater than predictions. So that's the reason I say that we have a sickness industry instead of a healthcare industry, and that the price of prescription drugs and patent is exploitive of the public. So that background, I would like to move into the first slide of this presentation, which I hope will piggyback on the blue zones that are being advocated by the National Geographic Society with all its media power to inform the public that the life processes of all our cells and all organs is dependent upon the nutrient molecules that we supply in our diet, which are hooked together in cellular synthesis under the guide of instructions in our chromosomes or DNA. And this carries out the biochemistry and the physiology of life, and that this approach of using more comprehensive nutrition is safe beyond compare, effective because it supports the engineering and design of life that is present in our chromosomes or DNA, and it is far more economical than any expert ever dreamed would be possible. With that, we'll go to the next slide. In this first slide, as we approach healthcare costs, you see 2 leaves of the aloe vera leaf gel, which starting in 1985, I was asked to be a medical consultant to a company only a few miles from my office. And inside each of these leaves of aloe, there is a hydrogel or gel in the middle of the leaf. That research was started in 1985 when I first got involved with this, very skeptical and doubting that it could be of major significance to support the health. But we found out that in this gel, there is a molecule, acetylated mannose, called ace-mannan, which if you add to this nutrient molecules that are lower or absent in the modern food chain, that in the metabolism of cells, that the DNA uses these nutrients to hook them together in cellular synthesis under the instructions in this code to make biochemical molecules that carry out the process of life. So with this, we'll go to the next slide. And healthcare costs is not a small item in the United States, and particularly with inflation that's hit everyone, with everything increasing. And these are just some of the things that have caused chaos in our environment is the Ukraine war, and then the war with Israel, with those that want to destroy that country. There's the threat of a new war with China and Taiwan, which they consider just a runaway part of their country. We have chaos in our streets, particularly in the major cities of the United States, actually burning down business buildings and even government buildings. And some call it just minor protest. We have millions of immigrants crossing the open border to the south of the United States that have some kind of diseases. Some of them are anti-American. Some of them are terrorists. Some of them are bringing in drugs. And it's such a problem that the border areas are sending by bus and plane these immigrants to northern cities in protest. We have, I have on my computer almost daily that the United States dollar, which is the method of international exchange for commodities, particularly oil and gas, that there are companies wanting to replace it with other currencies. We've had the coronavirus pandemic with mandatory shutting down of many businesses and churches and doctors' offices and hospitals. And interestingly enough, they have decided that abortion centers and alcoholic stores are essential, so they've left open, which causes population unrest. We have questions of competency in the federal U.S. administration of the White House. And then the World Health Organization rates the United States as #1 in healthcare costs. The figure there, and it's rising. And in periodic surveys, they say that the United States rates 35th among other nations in the quality of life and health status. So that's a lot of issues to challenge every person and to want to reduce their healthcare costs if possible without reducing their health status. Now, the question is, can comprehensive nutrition reduce healthcare costs? And I'll tell you the story that I worked with a metal fabrication company in Iowa. I think they had at least 300 or more employees. And one of the owners saw the value of more comprehensive nutrition added to the diets of the employees, and the company decided to pay 50% of the cost for dietary supplements if they would take them daily. Well, within this group, that was insurance was paid for by the company. One of the employees had a wife that had severe chronic hepatitis and did not respond to any effort medically. And the enzymes kept rising. And so she was on the liver transplant list, waiting, and there are just not a lot of livers available. And because of this offer at the company, she started on the uh, formulation of the time where the aloe-ace mannan was the primary dietary supplement, which other nutrients were added to. And lo and behold, her enzymes of her liver began to fall and even normalize to the point she was taken off the transplant list. And the last time I was informed, that says, well, I'll see you. I've been seeing you twice a week. I'll see you in a year. And so with this experience, I found out from the health service that when a group has a organ transplant, that means there's a very sad situation of chronic disease to even have the transplant, and that the management to keep from rejecting the transplanted tissues is so high and complications so frequently that healthcare group is charged with $1 million of at least future healthcare costs from that one patient that had been transplanted. And so this removed from this company a hickey, so to speak, for this group that if this transplant had been done, that they would be charged in the future, and their premiums would have to cover at least $1 million for this one patient. And so that's a true story that I was involved in, and it's important in regard to the nutrition can reduce healthcare expenses. Now, with a small pharmacy chain, if I recall, they had less than 20 pharmacists. They had a problem in small cities that finding a pharmacist to work when they have viral epidemic or some kind of health issue in the population. When people come in with their prescriptions, the pharmacists catch what the patients have and they can't come to work. And the big problem that the pharmacy chain had was that there weren't hot and cold running pharmacists around, so they had a difficulty even finding someone. And if they found one, they weren't familiar with where everything was in that pharmacy, and they were not as effective as the full-time employee. Well, this pharmacy chain decided to give their employees gratis the dietary supplement of the time that contained the aloe-ace mannan. And when I talked to the head of this thing, they informed me that they had no health care absences of their pharmacists for 2 years. And I began to try to get them to publish this, and so that more individuals could know that nutrition reduces healthcare costs. And this was a good example. Well, they wouldn't publish it because they feared that here they are distributing pharmaceutical drugs approved by the FDA, and that they're dependent on the pharmaceutical companies to supply them. And the State Pharmaceutical Association is very much in harmony with this, and they feared penalization if they went public with this. So they continued to offer this in silence, because nobody wants to take on the establishment that has indoctrinated our professionals across the country, as well as the lay population, that if you've got a physical, mental, or emotional problem, we got a drug for it, and you ought to ignore the cost or the toxicity and side effects, because our drugs are essential. Now, again, with the question we're asking, can nutrition reduce healthcare costs? We had a female administrator for 3 hospitals that were owned by the same people in the Northeast. And her husband, who'd had a chronic health problem, responded so well to more comprehensive nutrition. She sat down and figured that they had over 1,000 employees in these 3 hospitals, and that if they were to provide them with the nutritional supplement, that the absenteeism would drop and the attendance would improve, and this would run things much more smoother in the hospitals. And that with this reduce in healthcare costs like her husband had experienced, the premiums for these 1,000 employees would plummet. So to do this, she had to go to the hospital chain board of directors, and lo and behold, the physicians rebelled. They said that the employees, 1,000 of them, were a significant source of income for all the staff. And as the administrator kept trying to push this, I was informed she nearly got fired. And when she stopped it, she went on with her employment. So the dietary supplementation plan that had been worked out by this hospital administrator of all the benefits was dropped. Now, again, addressing the question, does nutrition reduce healthcare costs? We have a published paper, and I'll give you the citations there, in the Fisher Institute for Proceedings, Volume 3, Number 3, published in September 2004, of a nursing home that had 16 frail patients. 14 of them were females and 2 males. This is very common in nursing homes. Females live longer than males in the United States. By introducing the dietary supplements, they said there was an 81% improvement of health of the 16 patients in the nursing home. 5 of them were able to decrease their expensive medications with their toxicity and side effects eliminated. That 44 of them improved what they call the MDS, which is a group of factors which they call minimal data set for health status of the patients. A 44% improvement in their health status. 37% of the patients improved their mental state. 22% had a reduction in infections, primarily of their skin and lungs. And there was among these were type 2 diabetics, and there was a 50% reduction in their medications and 50% improvement in their quality of life. And the gold standard of hemoglobin A1C, which is you draw blood and the stroma of the red cells take up high glucose, and this reduced, which is the gold standard for control for type 2 diabetes. And with this increased nutrition, there were no adverse effects, no toxicity, and none of the individual's health status deteriorated during this time, and that the supplements were less expensive than the drugs that they replaced. And what you need to know is that polypharmacy, taking too many drugs in elderly people, is a major problem across the country. And it is thought by many experts to be one of the causes of what is called polypharmacy-induced dementia, that it's not Alzheimer's, but it's can't tell it from Alzheimer's because the drugs are toxic to all the organs, and the brain is one of them that it's toxic to. Now, in this nursing home, they estimated, gave me the figures, that they thought the annual cost savings by dietary supplementation was nearly $40,000, or $36,670 exact. And this came from ceased medications, reduced medications, the less supplies needed, less labor to take care of the patient. They didn't have to have state fines when they get inspected because things were better. And they didn't have any legal fees from any of the families because all the patients were doing so well. So there were many factors that increased the profitability of the nursing home and the quality of life, which is something you look for. Now, I was lecturing in Atlanta, Georgia, and at the end of my thing, a dental surgeon kind of grabbed me and said, "I'll take you to the airport. I'd like to talk to you in private." And it was almost a kidnapping. I usually stay around and answer questions, but he informed me that one of the things he did was dental work referred from dentists to implant teeth, and that these people coming in with bad teeth had uniformly bad health. And it was not only oral and topical poor health of their gums and teeth, but he said that by oral and topical application of the aloe ace mannin, that this restored bone, gums, and original teeth, that some of them, rather than having to take all their teeth out, their gums became so healthy and their teeth got back firm in the sockets in the bone that their original teeth and gums were so good, and this decreased the need for implants. And he thought I should know this. Well, I told him that that's interesting because I've been contacted by a large dental clinic in California, and they were taking the current dietary formulation and taking the small individual brushes that looked like a tiny Christmas tree, and having the people dip that little brush in the powder and go between the teeth, and that this eliminated gum infections, even cysts and abscesses around the teeth. And there was eradication of the periodontal disease, and the bones and the bone and the gums became healthy, and the density of the bone that held the teeth increased. And lo and behold, I had a 43-page published paper from the Republic of China that was paid for the Chinese government, that gave a notice on page 2 to our research done as a team at Carrington Laboratories in the 1980s and 90s. And then they went on and did research locally, which seemed to be this was a dental school, and they showed different types of bone that are in the skull and the jaw. Bone density increased, the quality of the bone increased, the gums tightened up, and infections went away, and there was remarkable benefits to the teeth. And one of the experiments I was having trouble believing it. It said that when they planned to do dental rod implants for infected teeth, that they didn't have to do this, but by the more comprehensive nutrition, that the pulp inside the abscessed tooth regenerated and the abscess went away. Well, I gave this to a dentist to see if he could come up with the same conclusion I did from the research paper. And while I was waiting for a response, I got a phone call from Houston of an individual that had an abscessed teeth. The dentist referred him to an endodontist to have the tooth drilled out and replaced with a rod, and take antibiotics. And he was in such pain, and they had to schedule in advance a few days. He put the pure aloe ace mannin on his gums through the day and night, and it decreased the pain. And when by the time it was to do the major procedure by the endodontist, he had no complaints, and so they x-rayed, and that the abscess in the bone and everything about the gums and teeth had reversed to normal. And they did different testing of the tooth, and they said that the tooth had been regenerated in the pulp and that it was a normal tooth again, just like this research from this Chinese dental paper that was published that is independent validation of the benefits I've been seeing for 39 years and never had the money or the funds to do the research to formally validate the benefits that I've been anecdotally receiving from patients, their doctors, their dentists, and other professionals. And in addition to this paper from China, they have an incredible bibliography that shows multiple sites and investigators, almost 100 that have published papers since the year 2000 that validate and prove up the benefits of more comprehensive nutrition to improve health. Now, I've had many statements from people about their benefits, but I will never forget the guy that came to me, said that he had spent over $1 million in healthcare costs, travel and hotels and out-of-home food expenses over a 5-year period, and nothing that medicine had to offer had improved his wife's health. And for less than $1,000 of the dietary supplement of the time that was built around the active ingredient of the aloe, her deviation from normal health had reverted to normal, where no medical efforts had been of any benefit. And so this was repeated multiple times at less expenses from people that say they'd spent months to years going to multiple medical sources, taking multiple drugs that had never done any good, and more comprehensive nutrition improved their thing. And one of the things is a condition up in the Northeast where the ticks cause Lyme disease. We had reports from individuals, their entire family, and even their dogs improved their health. And it seemed that the more comprehensive nutrition supports the engineering and design of life that is also designed for host defenses and healing. And this improved nutrition, that all their symptoms of Lyme disease went away, which is a very challenging diagnosis. So actually it developed that if we had individuals that they went to multiple doctors and no diagnosis could be made, and whatever their problem was, even if they had a diagnosis, nobody knew what caused it, and that no available prescription drug seemed to work, that this was a good filter, that these people tended to respond to more comprehensive nutrition better than just the average person. And you could do this with no toxicities and no adverse side effects. And unfortunately, these people that have these unusual conditions that nothing's responding, they frequently put them on steroids, which reduce the body's host defenses and healing. And by going to more comprehensive nutrition, it reverses these negative effects of steroid. And the aloe asmanine formulation as a dietary supplement is relatively low cost compared to particularly drugs in the patented thing, which most doctors prescribe because they have representatives coming around promoting and giving them papers about the benefits of the drugs that are on prescription, and they never mention drugs that are offered by the chains that have gone out of patent protection, and they're much cheaper. So this is the personal experiences that I've had, that there is a great benefit from dietary supplementation for health challenges. And I mentioned that I got independent validation that one can only dream might ever occur by this paper that I received from China that validated anecdotal reports to me, and a series of pilot studies that didn't have controls that showed benefit, but they weren't formal. As you know, standard medicine wants a double-blind, placebo, random assigned, multi-million-dollar study to say that there's any proof that anything is worthwhile. Well, this information I'm sharing with you is as old as the Hebrew Old Testament, where in Ezekiel 47, I believe it is, it tells how the fruits and vegetables are for the nutrition of man. And it ends with, depending on the translation, and the leaves of the trees shall be for either medication or drugs or for healing. And it's hard to get ahead of that, because these are leaves of the aloe plant, which is not a cactus in the particularly desert populations, but a lily. And it's the active ingredient from the gel that's in the leaves. So I think this is excellent experiences that nutrition reduces healthcare costs, and that the benefits of nutrition have been not only repeatedly observed, but in a very formal, expensive study from China, there has been independent validation, plus up to 100 published papers in multiple sites and countries that have tested the ace-mannan in the aloe leaf gel and validated the health benefits that support the engineering design of life that is coded in the DNA of our chromosomes that control cellular synthesis, utilizing nutrient molecules to hook them together in cellular synthesis to make bioactive compounds that provide the structure and function activity of our body. And when we don't have these nutrients in our diet, we have deviations from good health. And by providing these nutrients, it's really awesome and incredible at the support that you get by supporting the engineering and design of life, rather than poisoning it with man-made chemicals that, by seriously flawed evaluation process, is reclassified as a prescription drug. And if it's not too toxic, in other words, the LD50 and LD100, which means under FDA toxicity evaluation, how much of this does it take to kill half the test animals, and how much does it take to kill all the test animals? And if there isn't a wide window between 50% and 100%, they do not allow you to progress in the new drug approval process of the FDA. And if you look on the government website, there are multiple drugs that go through this flawed process that have to be taken off the market because of their toxicity and side effects, when millions of people begin to take it, rather than the few hundred or thousand that it's all that had to take it before it is approved as a government approved drug. So I think this is more than adequate experience that I shared with you that nutrition can reduce healthcare costs.